This is Dr. Scott MacLean, and this is a YouTube video about implant dentistry. Well, welcome back. This is part 2 of a 2-part session. First, we did some implant planning for a lower molar bridge. Now we're going to do the surgery. So if you typed in to see part 1, you could put MacLean for dentists only, and then you could find it even on my YouTube channel. So last time we designed a guide. Now we're going to take this guide. We've had it fabricated at the manufacturer. You can see these rings. These rings are very important to me during my surgery. So if you want to see this, how it was made, check back to the original part 1. If we look at the guide a little bit closer, we can see a metal ring. Why this metal ring? This metal ring has the angulation and depth of the final placement of the implant programmed into the ring. So when we made this guide on the last YouTube video, which you can go back and find, we found that this ring is going to tell us exactly how far down the implant is. So we can look at this and say the implant is going to be about 9 millimeters below this particular ring. So if you look here, as you do your drilling, this is all going to be compensated for by the drills. So we can see as we put the final implant in, it's going to be 9 millimeters below where this ring actually stands. When the 10 millimeter longer drills are placed into the sleeve, they're going to have the implant end up at being 9 millimeters below the top of that sleeve. So you can see this is the full penetration of the drill on the particular guide. The patient is a 64-year-old female in very good health. You can see as we retract that these are the only teeth that she's missing. So prior to me doing the surgery, I had to look around, and you can see the bone looks a little thin, but the planning session allows us to really realize exactly what bone is there and how we're going to use it. So we'll take the guide, make sure it fits on the model first, and we can see here this is an anchor pin. So the anchor pin is going to support the posterior part of this guide to make it so it's not going to rock during surgery, because if I cut the gingiva away, I don't want this guide rocking down in the posterior, changing the angulation and depth of this particular system. So if we get the anchor pin in, then we can support this, then we'll flap the tissue. So I don't flap the tissue until after this anchor pin has been secured and found. So you can see then the 2 implants can be placed. So we have the ability to place a 5 millimeter in the posterior and a 4.3 millimeter in the anterior. It's very important to make sure that the guide is fitting exactly the same as it does on the model. As we go to the mouth, we start to do our mid-crestal incision, which is based on our last planning session where we did the design of the particular guide. So as I go through, I want to make sure I'm cutting through the periosteum. If I don't do that, then it's going to make a messy flap. I like to use a molt reflector. So the molt is going to allow me to get behind the tissue and take this tissue off of the ridge. And it comes off quite nicely and clean. The cleaner the surgery I feel, the better the surgery and less pain afterwards. So if we take this off, you can see that we're reflecting, seeing the bone inside, and then we're going to have a good look at this and making sure that we reflect the flap to hold the flap down underneath where the anchor pin is going to be, so you can have that flap reflected, also have the cheek reflected by the anchor pin. It's also important to make sure you're not going to have the tissue sitting under the guide in this particular spot now, so make sure it's pushed back. So as the guide pin's put in, it's holding back the gingival flap and also the cheek, which makes it a little bit easier. In this case, we're going to use the 2 millimeter drill guide to kind of place into the guide sleeve, and this will allow us to do one of our first drills. Some people use the little ball to start. We're using this, and it's going along perfectly. So you can see I'm going to penetrate down to the depth that I want to be for my final surgery. So in this anterior position, we can go in with the 2 millimeter twist drill. You can place a drill stop on the 2 millimeter, but notice on this particular drill, the tapered drills, they do have a drill stop right here. So this drill stop is going to allow you to go down to the correct depth, and then the sides right here are going to keep you on angulation. So between the two, it keeps you in the depth and angulation that you need to place this implant. The drills have both internal and external irrigation, which helps to keep them cool during the drilling process. So you're going to be pumping them in and out as you're doing this to keep it cool, so you're not going to cause bone necrosis. The manufacturer recommends that the next part of the osteotomy, you're using a 3.5 by 8 millimeter long tapered drill. So as you go in, you're going to kind of be pumping it a little bit, letting the water go in and cool it, and then you're going to follow this with the particular 3.5 millimeter wide drill that you want to go to length. So in this particular case, we're going to be using 11.5. After this particular drill, we'll use a 4.3 by 11.5 tapered drill to go down and prepare the width and length of this particular osteotomy. And this is all being followed by that particular guide sleeve with the drill guides that have been placed inside of this. Now you may be wondering how we're going to get the implant 9 millimeters below this guide. You're going to use a guided implant mount which attaches to the top of the implant, and there's a driver for this. So as you take this out, you can see the implant is actually 9 millimeters below the top of this metal ring now. So as this goes in, it's going to put the implant in the exact position. So you can also pre-thread the bone if you want to, but we didn't have to here because the particular bone is not that dense. So we're using a 4.3 by 11.5 millimeter regular platform conical connection implant, which is that ideal implant for bone, because it has a very nice property of having a platform shift, which is going to be used for the bridge connection itself, and then the 45-degree bevel, which is going to act like the new platform shift and provide a collar of soft tissue around the implant. We almost have this implant seated. You can see it's going to just be touching just slightly there to the metal sleeve, and now the implant's in position. I like to do the anterior implant first so that I can then secure that so that the guide is still going to be now double secured with the anchor pin and also the implant itself. So we're going to go through the drill process for the distal implant as well. We're not going to show that completely here on this particular video, but once this implant is placed, then the patient is going to be well set to have their bridge in the ideal position based on implants that are going to be prosthetically driven. So we have the ideal spots for the implants and the screw channels be coming out the occlusal aspect of the bridge. Implants are going to be loaded axially even though they're connected together. But look at this. This is an ideal placement for a bridge. We can see the incision line. We've not sacrificed a lot of the tissue. And we have these implants angled so that they're going to be loaded based on the occlusion from the upper arch. So this is Dr. Scott MacLean, and this has been a YouTube video about implant dentistry.